This time I want to share a class from Dr. Jeremy Schmoe, and he is a very knowledgeable guy. He knows so much about concussions, and he made this class for the concussion community. And I thought, okay, it's one of the classes that get a lot of positive feedback. So I thought more people just need to know this, more people need to learn from him because he is really good. And yeah, this is one of the classes, of the many classes that are available within the concussion community. And we're opening our doors next week, so I'm really excited. And the doors will be open for 1 week, so until January 12th. And I just hope this is helpful for you. And if you feel like, hey, I want to know more, please add yourself to the waitlist and I will send you an email once we're open. But for now, just sit back, relax. The class will be about 20 minutes. I hope it will be helpful for you.
All right. Good morning, everybody. This is Dr. Schmoe from the Functional Neurology Center in Minnetonka, Minnesota. And today I'm going to be talking about brain inflammation and how it can develop after traumatic brain injury. And most importantly, what are the signs and symptoms that you get, and what are some things that you can actually do about it? And how do you know if you have brain-based inflammation? So on my website, there's an article. So if you go to the fnc.com, it's called, Do You Have Any Symptoms of Brain Inflammation, also called neuroinflammation? And it's a short article. It's really good. It'll help kind of break down what we're talking about today. So after the presentation, just go to the fnc.com, go to our research library, and there will be an article there on brain inflammation and the signs and symptoms that you get. So with concussion, head injury, trauma, what happens is there's an inflammatory barrage that happens in the brain. I like to say that with concussion, you have all of these circuitry issues that are going on, and those are changes in networks of the brain, like the frontal lobe, the basal ganglia, the cerebellum, brainstem, and vestibular system. So those are circuitry issues that can happen, but there's also this whole kind of chemical soup that's going on after TBI. So you develop changes in immune regulation. You have neurons and you have glial cells in the brain. And when you get these concussions, when you get these injuries, what happens is these glial cells kind of get activated. They get turned on, and they're called the microglial cells. They're kind of the scavengers of the brain. And what they want to do is go recognize healthy neurons and also recognize neurons that aren't functioning as well as what they need to. So the microglial cells can go basically tag them and clear them of that debris to help your brain basically heal. What can happen with more concussions? So you start getting 2 concussions, 3 concussions, 4 concussions, you'll develop a change in these microglial cells. They'll become turned on, ramified, and then they'll just start going after normal healthy neurons, bad neurons. They just scavenge and they just basically go after everything. And then that's going to affect basically the frequency of firing of neurons in the brain. And when you change that frequency of firing, you can just take that neuron and put it anywhere in the brain. So say, for example, if it was in the frontal lobe, you're going to have changes in the way that your frontal lobe works. And one of the things that can happen is a decrease in your motivation. So decreased motivation, decreased affect, and some of the things that you'll see clinically on an exam, you'll be looking at a patient and you'll see something like finger tapping will be slow. One side might be really quick. You go over to the other side and they're really, really slow. Or you'll see a change in their affect, change in their facial expression, change in the blink rate, change in the speed of movement. Everything just feels harder, everything's slower. The speed of their quick eye movements will be slower. And those are the types of things that you see when you injure your frontal lobe. So again, changes in the circuitry, but also changes in the chemical soup. So that's kind of where these worlds kind of come together of neurology and immunology. And when you have brain-based inflammation, it can really affect your circuitry. So I'm just going to kind of go into some immunology basics and kind of break some things down. And I have a chart that I'm going to go through. It's from a guy, doctor in North Carolina. His name is Dr. Sam Yannick, and he has a great program for any providers out there. It's called Cogence Immunology. So I'm just going to break down these charts here, and I'm just going to read through them. So what can happen is you can develop body inflammation. So you injure your brain. What happens is your gut barrier will start to break down. When your gut barrier breaks down, you'll develop full body inflammatory response. And with a change in your blood-brain barrier from head trauma, peripheral inflammation will basically leak up into the brain. And when that leaks up into the brain, you're going to get more of a neurological inflammatory response in the brain. And then that'll basically loop back around and shut down the way that your vagus nerve activates to fire back down to the gut. And when that happens, then you're going to have changes in your motility of your stomach and changes in basically inflammatory markers that are going to happen more in the periphery. So basically, it's kind of like a loop that's going on. Change in the brain, change in brainstem output, change in the gut, body inflammation loops back around, leads to more brain inflammation. More brain inflammation will lead to changes in inflammatory markers in the brain. It's going to tip those microglial cells on, and then they start basically going after healthy neurons and bad neurons that aren't functioning well. And then that leads to a change in the firing of your neurons, which will basically change the output of the circuits. And that could lead to a change in your frontal lobe, which could lead to a change in your motivation levels. So that's kind of how that circuit works, from body inflammation to gut inflammation, and then basically loops back around. All right. Other things that can be going on is you can actually develop a tipping of your immune system after you injure your brain. So with your brain, there's a whole immune system in your brain, and basically those microglial cells are involved with that. Your brain is one of the biggest immune organs that there is. It's not all just about, the circuits. It's about this complex neurochemistry that's going on with neurotransmitters, glial cells, hormones, inflammatory markers. So you can develop a tipping of your immune system where basically you have what's called Th1 and then Th2. Those are different sides of your immune system. And these systems are being regulated by what's called Th3 or T regulatory system. And you can develop a Th2 dominance after TBI, which is common. And what happens with that Th2 dominance is that it actually kicks into some inflammatory Th17 pathways. And these Th17 pathways drive autoimmunity. So with a brain injury, again, it can lead to brain tipping of immune responses, kick into autoimmune pathways. These autoimmune pathways are also very connected with inflammatory pathways. And it just leads to this whole kind of windup of brain-based inflammation that's going to affect you. And what do you get when you have brain-based inflammation? Brain fog, unclear thoughts, low brain endurance, varied mental speeds, brain fatigue, poor mental focus, brain fatigue when you have more systemic inflammation. So you might eat something one day and all of your symptoms get way worse. All right. You can develop food intolerances. You can be overly stressed by chemicals, scents, and pollutants. So that's one of the ways that I ask people, try and figure out, do you have brain-based inflammation? Is, do your neurological symptoms get worse after you've, say, been to a store where there's strong perfume smells? All right. That's something that you can ask your patients and basically see if there's some sort of inflammatory response. And what happens with that is, these smells will basically promote an aldehyde response, and then that'll kick into some histamine activation, then lead to an inflammatory response. So scents, being around chemicals, you eat certain foods, maybe some foods that are higher in histamine, or you start noticing that if you are having a glass of wine or a beer or something like that, you start getting worse symptoms. So those are some things that you can think about. Like, are you eating foods or around chemicals or something like that that's leading to your neurological symptoms getting worse? Okay. And if you're doing neurological rehabilitation, you're doing vestibular, you're doing visual rehabilitation, you're doing eye exercises, you're doing cognitive rehabilitation, and you kind of like get to a point where you're making progress, but your progress really seems to kind of like be like this. And then your findings are switching. Like one day you have something on this side, and the next day it's over here. You feel really foggy one day, good the next day, foggy one day, good the next day. When you're off, your gut feels really inflamed, or you're feeling lightheaded going from sitting to standing one day, then the next day you're fine. When you see things and findings oscillate like that, and findings are kind of jumping all over the board with you, good day, bad day, good day, bad day, there's most likely some sort of neuroinflammatory response that's happening in the brain. And basically, that will leave you non responsive to all the therapies that should be working for you. It's not that those therapies aren't working, it's that they're basically not building plasticity because of the immune dysregulation that's occurring in your body and the immune dysregulation that's occurring in your brain. And you're having an inflammatory response that's affecting the output of your neurons. And then those neurons, you take those and you put them in different regions of the brain, the cerebellum, the frontal lobe, the basal ganglia, the brainstem. And you have circuits that are sitting there firing good, and then they crash, firing good, and then they crash. You got to do a lot of cognitive work one day. Your system just wipes out and it crashes and it fatigues. So it's not like it doesn't work, it's working, and then it gets to a point and then it just fatigues out and then it wipes out and then you're done. Right. In those situations, when you're doing neurological rehabilitation, you're getting adjusted, you're getting manual care, you're getting acupuncture, you're doing syntonics, you're doing, different types of visual exercises, you're doing vision rehabilitation, you have prisms, you might be seeing a functional neurologist, you might be seeing, somebody that's doing craniosacral. These things are working for you. And then they just get to a point, you either plateau or you just fatigue and you crash. Most likely something underlying with your system that's leading to your system not building that function and building that plasticity, and then you're just plateauing. All right. Even things that you had prior to your concussion and your injury can come back and lead to some issues. So you might have already had a tipping of your immune system prior to getting a concussion. Maybe you had Lyme, cytomegalovirus, a herpes virus, some sort of increased viral load, or a gluten reaction, or some gut inflammatory response, or a parasite, or some other infection. And then that's leading to a tipping of your immune system, decrease in Th1, decrease in innate immunity. You start producing antibodies. You start actually producing antibodies against yourself, the brain. You can have neurological autoimmune responses against your own nervous system, against your own brain. And then you get an injury. And then everything that was already going on just gets taken to a whole new level. You kick into more of an autoimmune and more of an inflammatory response. And then that's going to go in and just change all the chemical stuff that's happening in your brain. And then that can lead to changes in affect, emotionality, changes in your limbic system, changes in your mood, and you feel very, very fatigued. So when I hear fatigue, I just think of those neurons not firing the way that they need to and not communicating with other neurons. And then that's leading to a lack of motivation from a change in your neurochemistry. And one of the neurotransmitters that's very, very important for motivation is dopamine. So a lot of the dopamine output comes from your upper brainstem. Dopamine basically needs a whole bunch of different cofactors to allow it to be able to be produced. One of those being like magnesium, iron. You need to also like clear the dopamine. So changes in your methylation pathways, detoxification pathways can be an issue with people. Brain-based inflammation will dump neurotransmitters. Anemia will dump neurotransmitters. Dysglycemia, changes in blood sugar regulation, will affect your neurotransmitters. And then changes in hormones. So think about this. You could injure the brain. It could lead to changes in your HPA axis. It could change adrenal function. It could change output, changes in your testosterone and progesterone levels. So for males, for dopamine production, testosterone is very important. For females, progesterone is very important. So sometimes there can be changes in your hormone regulation. Again, blood sugar, infections can lead to an inflammatory response, decreased dopamine. So there's all this stuff that's going on. So there's a reason why you have a change in your motivation level. It's not that you don't want to go, pick that sock up off the ground. It's that literally you just can't, just from a fatigability standpoint. Or you wake up and you really have to do some sort of chore. You got to do the dishwasher. You have to do something, and you literally just don't even have the energy to be able to do it. You're not motivated enough to do it. There's underlying chemistry and physiological reasons for why you have these things going on. And that makes it very, very hard for, say, your partner or your spouse to, actually like understand why you don't do some of these things. And it's not that you don't want to do it, it's that physically there's a physical reason of why you can't do these things. And it's chemical, it's inflammatory, it's brain-based, it's circuitry. All of this stuff is like coming together and affects your motivation levels to be able to go out and go do things. So, there are ways to, come out of this stuff. One of the best ways to do it is to do neurological rehabilitation and overall just activate your brain, activate all your neurons to get them firing to a level, a good high frequency of firing. And what happens is when you have that good high frequency of firing from different types of therapies, it will allow those neurons to produce signals to tell the microglial cells to leave them alone if they're healthy. And dead dying neurons will put off signals to tell microglial cells to tell them to clear them out, to allow your neurons and all the stuff to do the circuitry, the activation and things that it needs to have a good stable frequency of firing. So doing neurorehabilitation is a good idea. Vision, vestibular, stuff like that. But if it's not working or you're getting to a point, if you're anemic, if your ferritin's really low, if your blood sugar is just a mess and you're all over the place every day, if your stress physiology is through the roof, all right, because you have something physical going on, like an infection or a gut infection or a parasite, you need to work with somebody to get those things taken care of. And that will allow your neurology to function even better and allow the therapies that you're doing that are probably all really good therapies to work for you even more. So, those are some of the things that have to be considered. So I'll just kind of go through them again. You have body inflammation, which leads to more brain inflammation. More brain inflammation co-activates, loops back around, and leads to more body inflammation. Your vagus nerve gets shut down. It changes the way that your gut, produces, enzymes, gut motility. You get GI inflammation. You get changes in the GI motility. You can get stuff like SIBO, small intestinal bacterial overgrowth, more inflammation, loops back around. Changes in immune status, Th1 and Th2, changes in the polarization. You'll kick into some inflammatory pathways, including increases in histamine. Increases in histamine will affect your blood-brain barrier. Increases in histamine will go in and it'll affect, your cerebellum. It'll affect your cardiovascular system. It can lead to inducing dysautonomia and POTS. So there's this web of stuff that's going on that basically has to be addressed. You have to figure out kind of where in this do you jump in to do work. So again, infections and inflammation, Lyme disease, SIBO, parasites, mold, allergies, pre-existing things, can affect immune status, can lead to immune tipping, kicks into autoimmunity, neuroinflammation, affects the brain, affects the circuits, changes the way that neurons fire, and that can basically lead to changes in motivational levels and affect you huge throughout the day. Doing rehab, doing gut repair protocols, low histamine diets, figuring out food allergies and sensitivities, clearing out any parasites, doing some work to basically upregulate Th1, modulate your Th2, things like curcumin, resveratrol, other anti-inflammatories can kind of modulate that Th1, Th2. There are substances that you can take to increase Th1, modulate Th2. There's things that you can do to help basically break down histamine so it doesn't kick into these inflammatory loops as much. And again, cutting out gluten, cutting out dairy, keeping your blood sugar stable, fixing and trying to improve your gut so you don't develop anemia. Taking iron if you need to, and then taking precursors for dopamine can be helpful for motivational levels, decreasing brain inflammation, B12 status, B6 status, magnesium status, methylated B vitamins and glutathione to help clear dopamine. You need appropriate clearance, you need appropriate development of those, of dopamine, and that can really, really improve your overall brain function and then actually help your neurological rehabilitation work better. So I hope that kind of broke some of that down for you. If you are interested in working with me, just go to the fnc.com. We do week-long intensives. We've been doing it for 10 years. We have all of the functional neurology tools that you can imagine with gyrostim, virtual reality training. We do vision rehab, balance, proprioceptive exercises, manual therapy. We do different techniques to actually stimulate the vagus nerve through the gut with functional electrical stimulation and laser. We do non-invasive brainstem stimulation through the tongue, through the trigeminal nerve. Different protocols that we use for migraines and headaches. And then we run labs on everybody. We look at the underlying inflammatory stuff that could be going on. And we try and put these loops together of your neurology, your metabolic, and your structure, and really put everything together to help you move in the right direction and get past hurdles that might be going on with your rehabilitation. So thank you guys, and I hope you have a great day.